Dr. Booman is here to provide an introduction for our next speaker, and I want to briefly introduce Dr. Booman. He moved from South Dakota and joined Dentistry for Children in 2017. He received his dental degree from the University of Minnesota and then proceeded to achieve his pediatric specialty degree from Geisinger Medical Center in Pennsylvania. He's passionate about children's oral health and wants to empower families to pursue excellent overall health. He's actively involved in the ADA, and he is the public policy advocate for the Missouri Academy of Pediatric Dentistry. And more importantly, he's a member of the Missouri Coalition for Oral Health and on our policy committee, where he constantly upgrades the discussion. So, Dr. Booman, you have the floor.
That's very generous for you to qualify my comments as such. I appreciate that. Thank you, everybody. I've had the pleasure of meeting many of you. For those of you that haven't, thank you, Gary, for the introduction. I'm here to introduce Dr. Carol Berger and the video that we're about to see, Rural Children in Crisis. For those of you that have the privilege of seeing kids in your practices or in your lines of work, you know that dental care for children is an exploding issue, and we saw the numbers this morning from the office of the state office for dental health. You know, really their research has been excellent, and want to welcome Dr. Deaton to that role, and we're thrilled to work with you as well. You guys are going to see a lot of examples of what's coming up as to what these kids face, but I practice in Liberty, Missouri, which is northland suburbs of Kansas City, and we have kids coming in all the time from 2+ hours away that just don't have access to care. And then we end up, a lot of those children then need to be sedated for their care. So they then have to come back to Kansas City to the Children's Hospital, and where we can get their care done in one visit. That is the ideal scenario, unfortunately, for many of these kids, because a lot of them end up never being able to seek care for a host of different reasons, and they don't have anyone closer to home that either is qualified or takes Medicaid. So we have a crisis of multiple proportions. We have a lack of Medicaid providers. We have a lack of specialists for those providers to then refer children to that are outside of their scope. And we have a lack of OR access for them to be treated in a humane and for these little kiddos to be treated in a humane and compassionate manner. So it's a big problem, and we're working every day to make sure that we can do everything we can, not only at the individual practice level, but also with the Missouri Academy of Pediatric Dentistry and with the Coalition for Oral Health. So with that, I want to turn it over to Dr. Carol Berger, and she can move forward with our video.
Can you guys hear me? Oh boy.
Yes, but I think you may have two audio sources going simultaneously.
I do. I've got my phone.
Much better.
Okay, so that's good. Okay, so first of all, thank you, Dr. Booman, for that introduction. I really appreciate that. And I just want to give you a little background. I want to also thank Julie Bachman and Dr. Dane and all the people that helped make this documentary that you're about to see possible. But I started this whole project back in 2012 when I was a DNP student. And I had just I was just working in rural health by myself out in Ellsbury, Missouri. And I noticed that the children's teeth that when they came in for well child visits was really, really poor. And that began to make me do some research on what we could do. That could be my project to see if I could help with that. And about the same time, the schools in the area were kind of pairing up with the Missouri Oral Health Dental Department and implementing their oral health program in the school setting. And I got to know Dr. Gassalone, who's done a lot of good work out there. And so my DNP project was implementing that project, that oral health program into our practice. And then I worked there for 7 years and went into education and finally had a little bit of time to do my own research. And if you'll advance the slide, Dr. Dane and Julie Bachman were very, very instrumental in helping me to get all the data. What I did was, after I did implemented that project in the oral health program in our practice, I presented it to all the doctors in our little practice in that area, which involved 6 offices, and none of them picked it up. Even with Dr. Castellone, presenting the evidence, we sent 25% of the children in my clinic for oral care, and like Dr. Bowman said, that involves lengthy amount of time. Many times they lose up to 8 of their teeth, and they don't get them back for a long time. So they have speech problems and all kinds of things, but not one of the other offices picked up implementing the oral health program and putting on fluoride varnish at well child visits. And I was curious about that. When I got my new job as a teacher, I had time to do research, and my thought was, if I could look at all the data in Missouri for a 3-year period of time, because I saw it in the Ellsbury school. Every year, the amount of referrals that we sent out for urgent dental care was going down, and the overall condition of their teeth was improving. And so I thought, if I could examine all the data of every child in the state of Missouri that had their oral preventive care done through the system, I wanted to know if white spot lesions decreased over time, if presence of decay decreased over time, and if the probability of an urgent condition existed decreased. Now, obviously, we couldn't test the same child to see if the same child, because we didn't have a way of doing that. But just looking at overall data from those 3 years, we saw a decrease in white spot lesions, as you can see, significantly. And presence of decay overall, if children, and you've got to think these kids in school are the same kids most of the time. They're not moving around that much. So we're seeing that this program works. It really does. And when you combine it with fluoride varnish, which that data is coming out soon, that's huge. That's even better results. So if you can advance to the next slide, I wanted to show you. This was dental care providers. Now, they could bill from 2007 on, so we had data from that amount of time. And as you can see, the total in 2007 of bills that came in for Medicaid was 4,172. And by 2018, a significant amount of dental providers were billing for fluoride varnish services. And so that's really good. But look at the next slide. Let's look at the next slide. The next slide is medical providers. These are people like me, nurse practitioners and DOs, and so in the medical office doing this in their medical practice. And as you can see, their billing practices started in 2015, and they're growing too, from 1,800 to 8,500. But if you notice, the areas where the most they're hitting is children under 5. From the age of 6 on, they don't have much. Now, if you go back to the previous slide for just a second, if you notice that the dental providers, most of their numbers are coming from 6 on up. So if you really see how that's working, we're capturing the whole spectrum when we include those well child visits and we get the medical providers on board. So go to the very last one. That's 2 more. Yeah, there you go. So the Rural Children in Crisis was an attempt to show what's really happening in the state of Missouri by looking at the children and we traveled everywhere. We went down to the Boot Hill. We went to Jefferson City. We went talked to many different providers, and we saw a lot of different things. And where the gap is is 0 to 5 that we're still not hitting very, very good on. And I think that the answer is medical providers. There's one medical provider I talked to in St. Louis that runs a it's Cardinal Glennon pediatric clinic, and they actually in the Troy area are the only place known to be doing fluoride varnish, and they implemented it primarily because they had so many children coming in that needed pre-surgical clearance that they decided they had to do something. And they have made a difference and seen it go down because of what they've implemented. But what I've come to find out with my researcher is it's not a lack of education and training. The problem for the medical side is getting a system that works throughout the beginning to the end. Who's going to package the supplies? How do we identify which kids need fluoride varnish? How do we bill for it? And building that in to be a seamless process seems to be the answer to get more medical people on board. But I hope you enjoy my film. I made it in conjunction with two other professors from Maryville University. One is Scott Art Angus, and the other is Lily Keys. And then my friend Carlita did the music. So I think it's a very effective film, and I hope you enjoy it.
I think it's a great film. We're very pleased to be able to offer it as part of the conference. And you've already stimulated some really great questions in the chat. However, I'm going to ask that people wait for those conversations in the small group. So the idea here is we think this film causes people to really think about these issues that are going on. And so we want to get you into smaller groups and have you really dig into those questions. So with that, I think Ashley is going to give you a little bit of an intro to the groups after the film, I should say.
We're going to go ahead and play the film, and then we'll do an introduction to what the discussion and breakout groups are going to look like.
Like that.
I can't because I don't have teeth up here.
The sound has cut out, Ashley.
We got a call about the 2-year-old. He had just his teeth were rotted away here, like up to the gum. We did come and find out there was like Mountain Dew and soda in a bottle that would be so. And then the 4-year-old, his front teeth were just like black, black rotted away, old capped. The one where his teeth were kind of rotted away up to the gum, that they would have to cut the teeth out. So they said they would have to go under general anesthesia.
So now we're talking a surgery.
Yes. They initially did not want to shell out the money for an anesthesia.
So at 3 and 4, they were saying that they weren't going to pay for the anesthesia for 6 teeth to be removed.
Yes, that's correct.
And so what did you say about that?
I didn't know how they expected them to sit through something like that, being that young. I just remember it kind of as a traumatic day because you go in there and, obviously they're professionals, but just I feel like with the Medicaid system, it's more like a factory line. It's kind of get them in, get them out. They went under surgery. We did them both on the same day. They went under, and within like 10, 15 minutes of them coming out of anesthesia, we were in the car heading home. After the anesthesia wore off, they took him into a room. When they woke up, they said, give him a little bit, just make sure, there's not extensive bleeding, then you can let him up in the car. And so, we're heading home with 2 kids who are screaming due to the, coming out of the anesthesia. Everyone reacts differently, but kids tend to act more severe. So
would you say the barriers were for you trying to advocate to get help for your children, given the current Medicaid situation?
Well, there's not much help. There's not really like, oh, you definitely call this number for this, or you definitely call this number for this. Kind of like you're just thrown into it, and like, here's a general number to call, and I'm going to transfer you to like 5 different people. And we even struggled just to get a copy of the Medicaid card. Like, we had to use a form given to us by Children's Services that had a DVN number on it to use at doctor's appointments, and we still struggle to even get like updated Medicaid cards, because their health insurance may change every year, and sometimes we just don't even get one, and it's such a pain to call and say, hey, I need a card for health insurance card for my kid. So it's just there's just not a clear way to go about things. Like, if I call my doctor, it's very easy to get the help that I need, but for the kids through Medicaid, it's an extremely difficult time. Like, I have to set like a whole couple hours aside just to do the research into that.
I'm Dr. Gregory Castellone. I'm the director here at the Lincoln County Health Department Dental Clinic. It was established in about 2002. I've been a volunteer over the years. Been a director, been a volunteer, but now, since I retired, I'm working here every week, and we're trying to take care of the needs of the uninsured and the underinsured, specifically like Medicaid. Medicaid is hard to find because the state pays very little. If we were an FQHC, the state pays 90% of UCR, but when you're just a regular dentist or just a clinic like this, they only pay 30%. So funding is very difficult. So if the state of Missouri could up their fees a little bit, it would be a great help. So over the years, we've seen lots of kids with really bad teeth, but it seems like we're starting to see less and less of the rampant caries, and kids are getting the message. It's been rewarding to work here all these years. Improvement in their health, but there's still a lot. So many people that afford to go private practice and get their work done.
Some of the barriers that we see here in Lincoln County is Medicaid providers. They are dropping like flies very quickly. They're down to only our agency here in Lincoln County being able to see Medicaid adults and children. A lot of our specialists are starting to no longer accept Medicaid patients. So those specialty services such as endodontics for root canal and oral surgeons to see patients for removal of difficult extractions of teeth. We're finding that our closest resource is either Columbia, which is a 2-hour drive, or downtown St. Louis, which takes a little while for them to get seen in that facility. So our goal would be to work towards securing more providers. One of the reasons why I'm hearing that these providers are dropping is because of the reimbursement rate. Obviously here in Lincoln County, our Medicaid reimbursement is not substantial in any way. We could not fully sustain 100% on Medicaid reimbursement. It takes a lot of training and education for the staff members to know all the ins and outs of the billing procedures and know the guidelines that Medicaid requires for certain procedures, as well as the prior authorization. It doesn't, prior authorizations with Missouri Health by paper. Most of our private practice dental offices are all moving to electronic. So there's a lot of little things that add up to make it a much more complex system than what a private commercial insurance plan.
There are enough dentists accepting Medicaid to see children at the age of 1.
We here at the health department lowered our age to parents don't really take the. I know when we ask them about dental care, the majority of them have not seen a dentist at all.
Okay.
So,
and the
it's gotta be
recommendation
done.
is to be at 1 year of age. So tell us a little bit about the preventive service program and what you're doing across the state of Missouri.
So the Preventive Services Program is a program that's for children in the state of Missouri. Any child can participate, infant to 18 years of age. The thing that makes our program so unique, it's a community-based program. So the success of the program is based upon volunteers. When it started 13 years ago, we screened about 8,500 children in the entire state. Last year, our numbers are at over 92,000. So that's all for volunteerism, and that's the amount of children that we're touching with our program. And of course, we'd love to see fluoride varnish painted. The best way to get fluoride varnish, of course, is systemically by drinking water, which is why we advocate for drinking fluoridated water at a very, very young age, even during pregnancy. But, you know, still advocating drinking water because when they're permanent teeth are forming. So keep drinking that water to help make them stronger.
Is the drinking of bottled water fluorinated?
Most of the time it's not.
There's probably a little trace of it that,
But very little?
Very little.
So really it's the tap
It is
water.
the tap water.
So if in communities where the tap water is palatable, we have an issue.
We do have an issue. And you know, as you know, in a medical practice, there are times a particular doctor or nurse practitioner will recognize that community doesn't have adequate fluoride or the water. They can prescribe a fluoride supplement or dissolve in water. In addition to they could paint fluoride medical practice. We'd love to see that happen. Those pediatricians, those nurse practitioners, those babies, first tooth that comes in, start telling, let's put that fluoride varnish, let's protect it right now. And I really think that would be advantageous to see great decay immensely in the state of Missouri.
So tell us a little bit about what the Department of Oral Health and Senior Services does in the state of Missouri.
So what we do, first off, what we had in 2004, we did a Show Me Your Smile survey, just to assess the dental health of kids in Missouri. And from there, we saw a definite need. We have decided to go out and do screenings to the different schools that would like to participate with us. We do screenings to assess their dental health, and then we also apply fluoride varnish. That's twice a year. And that program has ballooned so much. Just recently, we were awarded 2 new grants, one from CDC and one from HRSA. Our CDC grant is to help to promote the importance of community water fluoridation. Currently, Missouri's water fluoridation rate, there are about 75% of our population on fluoridated drinking water. We would like to increase that at the optimum levels. It's a definite positive. That is a very good thing for people's overall dental health. The other thing that we're working on with CDC is improving the sealant rate in Missouri. We have a couple contracts that we are working with some local public health agencies to go out to different schools and via teledentistry to apply sealants to kids. A lot of Missouri is in a dental HIPSA, healthcare provider shortage area. I think it's like 80% of Missouri is a dental HIPSA. And teledentistry is a great way to reach those kids who can't reach dentists, who aren't close to dentists. You know, they might have to drive an hour or 2 hours to even see a dentist. So teledentistry is a great way to bring dentistry to them at their schools where we know that they will be.
With teledentistry, you're able to use the technology we have available today, such as electronic health records, cameras, intraoral scanners, and x-ray equipment, to then store the data and send it to a dentist who might be 30 to 130 miles away. it can be any allied health professional that can submit that data to the dentist. So in a hospital or primary care office or oncology department, being able to communicate using today's technology can lower those barriers so that we can get patients into the appropriate provider so they can get the care that they need.
We've had a lot of instances with teledentistry where we were able to just access kids who would never go to the dentist.
What do you find their teeth looking like?
Really depends. I would say the most the Head Start setting, and wouldn't believe that you would be able to take a 3-year-old, but a ton of times I've done it. I mean, those are not as difficult, and those are like a population that, you know what I mean? Sometimes they even, like a general dentist won't even see a kid that's 3 or 4. They have a mouth full of baby teeth, and a lot of parents have the ideology or the misconception that those teeth are not important, and those kids are in pain to express what that pain is, you know what I mean? So those were some of my greatest cases when you see a nurse practitioner say, "Hey Tiff, I got something I want you to look at." I go and take a look, and they say, "Okay, come." The doctor. The doctor says, the nurse practitioner might say, "I don't know if this is plaque or I don't know what this is." And I don't even really want to look at it, you know what I mean? Because, I don't,
Well, she had an expert to grab.
Yes.
Right?
So she grabs me, and I'm like, okay, I have an idea that it might be this. I'm going to consult with the dentist. I will, we had a chat system that we can talk to dentists remotely. Say, hey, can you look? Say, hey, yeah, that's that. You give me antibiotics. You schedule them for appointment, follow-up appointment. Yeah.
So it's about time we bring them both together.
Oh, yeah, for sure.
Thank you so much for talking to us today.
No problem.
All right.
Okay, thank you.
Thank you. You gave us great.
Hi, I'm Carol Berger. I'm a family nurse. I've been a family nurse practitioner for the last 11 years. 7 of those years I worked in rural health. And I saw the devastating effects of oral disease in children under 5 years. They had cavities, they had pain. Sometimes you couldn't even touch their teeth with food. We, in our own studies, sent 25% of the children for oral surgery because their disease was so severe. Means for a child who's 5 years or under, they have to be put under general anesthesia. And after these teeth are pulled, they have to live with the absence of their teeth for years before permanent teeth come in. If they have 4 teeth on top and 4 teeth on the bottom removed from their tooth, it's going to be 4 or 5 years before they get teeth back. That is devastating to them. They have to eat differently. They talk speech issues. They have a social stigma of just not having their teeth for that long. It is something that we can do in our practice. We can help with this. As medical providers in family practice and pediatricians, we can add examining the mouth and part of their little child visits. We see them at 3 months, 6 months, 9 months, 12 months, 18 months, 36, 24 months, and 36 months. That's 6 times. We can also look at their teeth. We can take a simple brush, and as you've heard in this documentary, bright varnish works. It reduces cavities. It strengthens their teeth. We can apply this in less than 6 months. It doesn't take any time. And the state reimburses. Oral disease is the most preventable chronic disease. And together, we can work with the dental community to help make a difference in a child.
Smile real big.
I apologize. I think there was a rendering issue, I think. But if you get a chance, go to the Missouri website and take a look at the film. It's a lot smoother, but I think it got the point across, and I really appreciate you having me.